don't know what I did with my remarks. I had them earlier today. It says mic muted, right? It was down here, no? Okay. Good evening. This is Toni Preckwinkle speaking, President of the Cook County Board of Commissioners. I'd like to welcome you to a virtual equity town hall related to COVID-19 and our vaccine program. Let me introduce the panelists and thank them for being here. First of all, Cook County Commissioner Dennis Deere, who is the head of our health committee, Dr. Kiran Joshi, who's co-leader of our Department of Public Health in Cook County, Israel Rocha, who's our new CEO of Cook County Health, and Denise Barreto, who's the Cook County Director of Equity and Inclusion, who will serve as our moderator. You know, before I begin this town hall, forgive me, I'm a history teacher, and this is an extraordinary moment in our country's history. I got up this morning and was ecstatic that the Democratic Party had won 2 seats in Georgia, an extraordinary moment, surely, in our nation's history. A black man elected to the Senate from Georgia, 2 Democrats elected from Georgia. But my euphoria was short-lived because what we saw today in the Capitol was insurrection and sedition. And I can't, in my lifetime, frankly, say that I've ever seen that before. Insurrection and sedition. Let me quote to you, as I said, I'm a history teacher, so let me take a moment to quote from our former president, George Bush. Here's what he said. Laura and I are watching the scenes of mayhem unfolding at the seat of our nation's government in disbelief and dismay. It's a sickening and heartbreaking sight. This is how election results are disputed in a banana republic, not our own democratic republic. I'm appalled by the reckless behavior of some political leaders since the election and by the lack of respect shown today for our institutions, our traditions, and our law enforcement. The violent assault on the Capitol and the disruption of a constitutionally mandated meeting of Congress was undertaken by people whose passions have been inflamed by falsehoods and false hopes. Insurrection could do grave damage to our nation and our reputation. In the United States of America, it is the fundamental responsibility of every patriotic citizen to support the rule of law. To those who are disappointed in the results of the election, our country is more important than the politics of the moment. Let the officials elected by the people fulfill their duties and represent our voices in peace and safety. An important statement by a former president of the United States, a Republican former president of the United States, in this very difficult time for our country. As I said, as a history teacher, I couldn't help but begin by acknowledging the moment that we're in. But the purpose of the forum today is to talk about our COVID-19 vaccination efforts. And let me return to my remarks about that initiative, our town hall. You'll have an opportunity for questions and comments in the Facebook chat, and we'll address them later in the program after our presentations. As we celebrated the new year this week, tonight's topic is also representing a new beginning of sorts. The past year has been extraordinarily, tremendously challenging for the people of our country. And now, a year after the first reported case of COVID-19 in Cook County, we continue to lose lives each day to the virus. It's unfortunately true that in this country, we're losing 3,000 people a day to COVID-19, more than we lost in a single day on 9/11. 3,000 people a day. But the arrival of the Pfizer and Moderna vaccines last month inspired hope when we needed it most. I'm cautiously optimistic for the future and a return to normalcy, but we know that the vaccination of millions of people will require time and increased supply. Many of Cook County's medical workers and emergency personnel have already received the vaccine, and I'm hopeful that production and distribution will continue to ramp up in the coming weeks and months. I'm proud to say that Cook County has prioritized equity in our distribution plan. The Cook County Department of Public Health has developed a flexible, responsive vaccination program that can accommodate different vaccines. The vaccine will be free to residents. We're working closely with partners such as hospitals, healthcare facilities, retail pharmacies, and nursing homes to ensure that residents can get the vaccine at a site convenient for them. I'd like to let Dr. Joshi tell us more specifics about the vaccination plan in his presentation, but the bottom line is that the vaccine is safe and effective, and I urge residents to receive it when their time comes. Now I'd like to turn the program over to Commissioner Dennis Deere, who, as I said, is chair of the Health Committee of the Cook County Board of Commissioners. Commissioner Deere.
Thank you so much, Madam President, and I want to say good evening. First and foremost, I want to say thank you, Madam President, for your stand for equity in Cook County and beyond. It is certainly one that is unprecedented and one that is needed. And I say that because we have had an unprecedented number of African Americans and Latinx Americans who are living in underserved communities who are actually impacted by COVID. In fact, the COVID numbers in these two populations, it kicked off being the highest, and it's still running pretty high. And so equity is important. This equity town hall meeting is important. So I want to say thank you. There's an old proverb that says education is never neutral. It's either liberating or oppressing. Education will either set you free or put you into bondage. I like to call what we're doing tonight liberation education. As Madam President said, my name is Dennis Deere. I'm Cook County Commissioner of the 2nd District, also chair of the Health and Hospital Committee for the Cook County Board of Commissioners. What that means is I provide, obviously, chairmanship over the committee, but I'm also a member of the Board of Directors of the Cook County Health and Hospital. And so I'm thankful for that. I represent our Board of Commissioners on health and hospitals. We believe that it is important that we educate our people, our constituents all over Cook County, and we represent over 5 million individuals in Cook County. As you very well know, there's 17 of us. This is very, very important as our Department of Public Health, our CEO of Cook County Health, and some of the other doctors that are present with us give us this information. Socrates said a long time ago, if you always do what you've always done, you're going to always get what you've always got. It is important that you ask the questions that you have tonight. And I understand it's about over 800 people that pre-registered for this. Ask the questions. I know that constituents that I have been talking with, some people are concerned. They have concern because this is uncharted territory for them. We want to provide some comfort to you and let you know that although this is uncharted territory for you, it is for us as well. And we want to try to make you as comfortable as we can by providing the information. This is the first of many virtual town hall meetings because we want you to be prepared for when the vaccine is time for you to receive your vaccine. Again, thank each and every one of you all for coming out. We are here to support you. We are here to communicate with you. And I'll end with this. In order to get something that you've never had, you got to do something you've never done. Now that's a Deerism. I'm going to turn you back over to Miss Denise Barreto, who is our moderator for this evening.
Good evening and welcome everyone. And thank you, Commissioner Deere. I think we're at this point ready to introduce the rest of our panelists, and I will welcome them in one by one. You've met Commissioner Deere. Our next panelist is Mr. Israel Rocha. He is our CEO of Cook County Health. Dr. Greg Huhn, who is also from Cook County Health. Dr. Claudia Fegan, who's also from Cook County Health. And Dr. Kiran Joshi, who's our Senior Medical Officer from the Cook County Department of Health. At this time, Dr. Joshi is going to present an opening presentation, and then we'll start in our panel with with questions that we have, and then we'll obviously be looking at your questions throughout the evening in the chat. Dr. Joshi?
Thank you so much, Ms. Barreto. As you mentioned, I'm a senior medical officer and co-lead at the Cook County Department of Public Health, which I co-lead with my colleague, Dr. Rachel Rubin. So I wanted to begin on this unfortunate grim day with some grim numbers, just to provide you all with some context about the current situation in suburban Cook County. So as of today, January 6th, we've got 181,356 confirmed cases of COVID-19. And by the way, this is for suburban Cook County, which is our jurisdiction. We also have a total of 3,439 deaths. And I want to pause here for just a moment, because while I am a public health doctor, I'm also a family doctor. And I wanted to just take a pause to acknowledge all the richness of the lives that have been lost over the past year to really what is the scourge of COVID-19. And so our goal going forward is really to ensure that as a health department, we are keeping that at front of mind and working extremely hard for all of you in suburban Cook County to address this pandemic. So on the lower right-hand corner of this slide, you see a graph, which is essentially a graph of all the cases of COVID-19. On the left, you see that first little bump, which is essentially that spring surge or that peak of cases that we experienced back in April and May and June, followed by a leveling off and really a steep incline, which represents the significant surge that we saw in the late fall. As you can see, the numbers here are going down and down with a few notches there that could well represent some increases after Thanksgiving and potentially after the holiday season that we just passed. So I want to transition now to just talk a little bit about the two vaccines that are available to the public at this point. The first, of course, is the Pfizer BioNTech vaccine. This is the first ever mRNA vaccine. And this technology is a new technology, and it's what allowed for the rapid development of this vaccine. It requires 2 doses, which are 21 days apart, and also requires what you may have seen covered in the media, this ultra cold storage. And it has to be used really quickly after we thaw it, which means there are a lot of complexities and planning and thoughtfulness that go into how we use this vaccine. The research on this vaccine was primarily from a vaccine trial or a vaccine study that included 44,000 participants. This large group of people were randomized to either receive just a saltwater injection, a saline injection, or the vaccine. It included 9.3% African Americans, 28% Latinx folks, 4.3 Asians, and all were adults that were 16 years of age or older. The safety profile here for this vaccine, as demonstrated by this vaccine trial, were very, very minimal and included things like just some pain and soreness at the injection site, possibly some fever and fatigue, the sensation that one might have just a low-level kind of flu. The efficacy, and we can interpret this to mean the effectiveness overall of the vaccine after 2 doses, was 95%. So this is very, very high, particularly for a vaccine that's so new and was just developed to have this kind of effectiveness, has been called a triumph of science and public health. The really good news is that this effectiveness was very similar across all ages, genders, races, ethnicities, and those with high-risk conditions. The other vaccine, the next one that I'd like to talk about, the Moderna NIH vaccine, is very similar to the Pfizer BioNTech vaccine. It uses the same technology, also requires 2 doses. fortunate in that it doesn't require that ultra cold storage. We can use standard freezers, which makes it a little bit easier to transport and distribute. The study size here was a little over 30,000 people, again, randomized to either a saltwater injection or the vaccine, and was also generally representative of our population. Same side effect profile, very mild, and really similar efficacy or effectiveness of about 94%. One note that I just wanted to make is this trial also included or provided some evidence that the vaccine protects against asymptomatic COVID-19. What does that mean? Well, as we know with COVID-19, some people get really sick, some people feel like they just have the flu, and some folks may not be aware at all that they have COVID-19. And because in this trial, they tested people occasionally to see if they had COVID-19, even if they may not know, we saw in the data that it might protect against folks getting this really low level of COVID-19. Again, the efficacy here was pretty high across a number of different characteristics. And as with the Pfizer vaccine, you get full protection about 2 weeks or so after that second dose. So I mentioned some safety considerations. I'm sure folks are wondering, can I get it? Can I not? The good news is that there are really very few reasons to not get the vaccine. And CDC, the Centers for Disease Control and Prevention, recommend that the only people who shouldn't get vaccinated are folks who have had severe or immediate allergic reactions to the vaccine itself or any components of the vaccine. So this is something that if you're interested, you could always have a conversation with your provider about if you have a history of allergies to learn if they're one of the things that make up the vaccine. There's a specific ingredient called, a specific chemical called polysorbate that's related to one of the ingredients in the vaccine. And so anyone with an immediate allergic reaction to that particular chemical also shouldn't get the vaccine. There's another group of folks who may want to take caution and again have a discussion with their healthcare provider before getting it. And those are folks who have had a severe allergic reaction to any vaccine in the past or any injectable treatment. And that could include treatments that are injected into your muscles, treatments that you got intravenously, or other kinds of injections. You may be aware that there were some widely covered incidents, just a few, a very small number, early on in the United Kingdom, where individuals experienced allergic reactions immediately after getting the vaccine. Again, I want to emphasize this was a small number of people, and in order to anticipate that happening here in the US, the guidance is to make sure that medical treatment is immediately available wherever vaccines are going to be being administered. Vaccine providers are also cautioned to observe patients after vaccination to monitor for the occurrence of immediate allergic reactions. So for some folks, we'll be watching for 15 minutes, but anyone with a history of any severe allergic reactions, we would be watching for longer, up to 30 minutes there. So I want to transition here to just the thought process behind when people can get vaccinated, when different groups of people could get vaccinated. And what's driving this are recommendations from the Advisory Committee on Immunization Practices. This is a national committee made up of experts from various fields that provides guidance on a number of different kinds of vaccines. They've produced guidance that helps us determine who should be prioritized for vaccination. And this is the guidance that we've been following as we roll out vaccine in suburban Cook County. So the first group is made up of healthcare personnel and long-term care facility residents and includes three large buckets of individuals. The first is hospital-based healthcare workers who were prioritized because, of course, they have the highest risk of exposure. And here I'm talking about your doctors, in the hospital, in a critical care unit, taking care of some very, very sick people. But it also includes environmental health and cleaning staff that may be exposed to COVID-19 as well. The next big bucket are long-term care facility residents and personnel. So these are folks who may reside in nursing homes or staff nursing homes. And of course, we all know how COVID-19 has had an incredible, huge impact on nursing homes across the country. So given that one of the primary goals of our public health response here was to protect the healthcare system and ensure that our hospitals and healthcare workers weren't being overwhelmed, it follows that this group of people who were really at high risk of getting very, very sick were prioritized for vaccine. The next group of people are community-based healthcare workers. And this is everyone from your physical therapists and your home healthcare workers to your family doctors working in the community. It also includes individuals who are EMTs and paramedics, EMS personnel, because while they're first responders, they are also healthcare providers. So the next phase is phase 1B, and this is composed of two large groups. The first being frontline essential workers, and the second being our seniors. Now, I want to make mention that the guidance that I'm talking about here is CDC guidance that was current as of December 20th. More recently, the state of Illinois and the governor's office announced that they're dropping the age. So this is a little bit of a distinction from the guidance that CDC has produced. They're dropping the age from 75 years old to 65. So anyone who is 65 and up is eligible for vaccine once we enter phase 1B. And again, that's hot off the presses, IDPH guidance as of today. The second large group of people here are frontline essential workers, and CDC defines these folks as workers who are in sectors essential to the functioning of society and are at substantially higher risk of exposure to the virus that causes COVID-19. This includes many, many groups of individuals, including first responders, education, the food and agriculture sector, manufacturing, and so forth. So these are very, very large groups. And just as IDPH provided some refined guidance to the other group of individuals making up this category, we believe that there's going to be additional guidance that follows to help us interpret and sort of break down these large groups of workers. Okay, the next phase here is phase 1C. And you see my first bullet here is folks who are 65 to 74. That's from the CDC guidance. According to what we're now hearing from the Illinois Department of Public Health, they would be in phase 1B. So phase 1C would essentially be individuals who are 16 to 64 that had high risk conditions that CDC has defined and include things like heart disease and diabetes and so on. It also includes any essential workers who are not included in phase 1B. And of course, phase 2 would then be anyone who is 16 years and up that wasn't included in the previous phase. As you can see from the diagram in the lower right-hand corner, there's not going to necessarily be an on-off switch as we move through these phases. There will be significant overlap between them all. However, as we move from phase 1A to 1B to 1C, we will very clearly and consistently communicate to the public. Okay, so I think many of you are likely asking, how is it that I'm going to get vaccinated? How are public health officials, our health systems, our local governments, our state governments going to get vaccines or shots into arms? Well, this is, I think, going to be a massive endeavor. And I think it's going to be something on the order that we have not gone through as a country since World War II. So our overarching strategy is to partner. And partnership is going to be key to achieving the goal that we need, which is 70% vaccine uptake to get to herd immunity. So we intend to take the lead in coordinating, in immunizing critical populations, and identifying and bridging those gaps in coverage that we know exist, particularly with our most vulnerable populations. So some of these partnerships include partnerships within Cook County government. I want to assure you all that your local government is working together with all departments focused on how we can effectively vaccinate our population. And that includes things like how we store the vaccine, receive it, and distribute it, to setting up sites in the community for vaccination. Of course, we're also working very closely with our partners, our friends, and colleagues at Cook County Health. And Cook County Health community health clinics are going to be starting to vaccinate healthcare workers and EMS as early as this month, within a week. We also have a really nice partnership with colleagues in the southwest suburbs, through which we have been vaccinating EMS personnel. And as I mentioned, we're also planning for community-based vaccinations with 3 sites spread throughout suburban Cook County and tents at Cook County Health Clinic sites. We are also planning partnerships with hospitals throughout suburban Cook County, and have been working with Loyola Northwest Community Hospital and Lutheran General for the provision of vaccine to their healthcare workers and EMS providers. And we're also in discussions with hospitals for the vaccination of community-based healthcare workers. Of course, we're also working very closely with the existing healthcare infrastructure, the community healthcare providers throughout suburban Cook County, including federally qualified health centers, community health centers, and private clinics, some of which have received vaccine from us and are going about vaccinating their own staff this week, with the idea that they would begin vaccinating members of the public, specifically those who are in phase 1A, those other community-based healthcare providers, in the coming weeks. There's a very large federal pharmacy program, which is a partnership with CVS and Walgreens. This is going to start vaccinating long-term care facilities and is actively vaccinating residents and staff in those long-term care facilities as of this week. We've had a really fruitful partnership with Jewel Osco, which started vaccinating healthcare workers last week, and has vaccinated 3,000 as of earlier this weekend. That is set to expand over the coming weeks. And of course, we're not stopping there. We're also in discussions with other pharmacies in the area, including Sam's Club and Walmart. Finally, I just want to end by directing you to some resources for ongoing information. So if you're someone who wants to continue to receive information from us directly, please sign up on our website. I have the link right there. I'm sure we're going to drop it into the comments, and I'm sure this slide deck will be shared. I would encourage everyone to check out our website, cookcountypublichealth.org. I do want to make mention that that link is intended for healthcare workers, but it's open to the public to sign up and receive information. We also have a link through which healthcare provider organizations can sign up to get their staff vaccinated. There's also information that will be shared through organizations that sign up on that link of how to become a vaccine provider. And finally, while we are the local health department for suburban Cook County, I'd be remiss if I didn't acknowledge my colleagues at the Chicago Department of Public Health. And I have a link on the screen here where you can go for additional information on COVID-19 vaccine planning and activities that the city of Chicago is working on. That concludes my comments. Thank you so much for listening.
Thank you, Dr. Joshi. And I just want to reassure everyone, I see the comments that are on fire asking about timing. I know that Dr. Joshi did give some of that in his remarks. Just just have a little bit more patience with us, I want to introduce Miss Israel Rocha. He's going to have some quick comments, and then we are diving into all those questions. Just know that there's some folks answering them as we go, and we are going to be putting links up to scroll across the bottom. Mr. Rocha?
Good evening, everybody. I really don't want to take too much time because today's really an opportunity for us to answer your questions. We talk a lot about health equity and what that means. And tonight is a step in how we can achieve that. Health equity is simply removing the barriers that keep us from being able to maintain our own health and safety, being able to prevent us from maintaining health for our family. And that's really what we're trying to accomplish tonight, is to bring the experts to you so that you can ask the questions that you need. This decision is very important. It's one that can safeguard your safety and that of your family. This is so much more than just the topic that we talk about with our friends, that we use, and we sometimes forget of the illness and the pandemic, that even though Illinois is doing better, we see the rest of the country at an all-time high in admissions and in its prevalence going throughout the country. So this is a serious moment, a moment for you to listen to what our team has to say, for you to ask the questions that you need answered, and for us to remove those barriers so that you can have equitable access to the vaccine, make an empowered decision for the safety and well-being of your family, and allow us to work with you on a journey so that we can make sure that one day we can be COVID-free. Thank you so much, and look forward to your questions tonight.
Thank you. Thank you, Mr. Rocha. I want to just start because there's been so many questions, and Eric Stein has a great one that I think that we should start with. Eric Stein asked, and I think someone put up he wanted to know if all this information only applies to suburban Cook County, and that is correct. When we're talking about our distribution, we are absolutely, and several folks have put the Chicago Public Health Department link in the chat. We'll also scroll it at the bottom. We are absolutely talking about suburban Cook when we're talking about our distribution. I'm gonna just jump into a question that's being asked, and I'm gonna ask one of our doctors to answer. One of those was related to the different levels, right? Someone said that they have a senior, a person in their family that's a senior, that's not at an assisted living, that's 91 years old. And I know, Dr. Joshi, you had the chart. That's come up a couple different ways, a couple different times. Would you mind please reiterating where someone who's a senior, 91 years old, in the various the phases that we talked about, and remind people what phase we're in right now?
Thanks so much. So we're currently in phase 1A. And as I said, the focus there has been first on hospitals, then on residents and staff in long-term care facilities like a nursing home or an assisted living facility, perhaps, and then on healthcare workers who are mainly based in the community. For someone who's a senior, if they live in a nursing home or an assisted living facility, for example, they would be eligible to get that vaccine. And someone from CVS or Walgreens is likely working with that nursing home or assisted living facility to make sure that all the residents and staff there are going to be vaccinated. If they're not in one of those facilities, if they're out in the community, then it's going to be in phase 1B when they would get vaccinated.
Thank you. Someone asked, and I'm trying to get back to them, but they asked, should they go to their private physician to get the vaccine? I'm not sure who I'm directing that to, maybe Dr. Joshi or Dr. Joshi, I think that's you. Should people go to their private physician, or should they go to Cook County Health Department? That was the question.
So right now, vaccine is being distributed mainly to hospitals and then health departments, and we're redistributing to certain providers who, for example, have a lot of capacity to vaccinate. So you're unlikely to be able to get your vaccine from your private provider at this time, But as vaccine availability grows and grows and grows, we do hope that you can walk down the street, go to your family doctor or your Jewel Osco or CVS and Walgreens, or your Cook County Health Clinic and get vaccinated.
So several folks have said in the chat that they did sign up already on that website, the link that you put up, and they're asking, is there anything else they need to do? They did sign up, and a couple of them said they did get confirmations. I saw a couple people who said they didn't, which means you probably didn't complete it, because within the chat you had your peers telling you if you didn't get the confirmation, it may not have been complete. So what can we expect in the way of information, and how often?
Well, I'm excited they've signed up. We've gotten thousands of people who have signed up. And our commitment is to provide weekly updates on a weekly basis as to what phase we're in, what actions we're taking to push vaccines into the community, and eventually how and when folks could get vaccinated.
All right. Another question, and it's not just one question, it's probably 15. Do we have some timelines? We know right now we're in phase 1A. And is there any sense of timelines on our next phases?
I can address some of that. So I think that with
Tell us who you are, by the way.
Pardon me?
Introduce yourself.
I'm sorry. So I'm Greg Huhn. I'm with Cook County Health. I'm infectious diseases, and I'm one of the leads in the vaccination program here for COVID-19. So we know for Tier 1A that there are approximately 400,000 healthcare workers and those living in long-term care facilities that actually are at high priority for vaccination. We believe that that to capture all those, it may take us through the end of January and probably into the beginning of February. So we can anticipate as we move to Tier 1B that may occur in February. And then there's a certain amount of people that really need to get through Tier 1B before we move to Tier 1C, and that would probably be perhaps in April. And I will say that the way that these tiers were designed was really, it was guided by 4 ethical principles as established by the CDC. One is to maximize benefits and to minimize harm, and Dr. Joshi talked about that. Certainly with what we know about how effective the vaccine is, how safe the vaccine is, and the vital contributions of who actually is then designated per tier. Secondly, and importantly, to mitigate inequities. And so really there's outreach to those communities of color to make sure that those burdened now by COVID-19 are set at a priority that we recognize that they need to be in a certain priority group, that they will have access to the vaccine. 3 is to promote justice. And very important, that goes hand in hand, I think, with mitigating inequities. And 4 is to promote transparency. And so that's why we're here today, where now we've set up this system. We have estimated timelines. We actually know who people are. We know who people are in these certain jobs and certainly age categories and those, and we're identifying those now in Cook County, those that do have those chronic medical conditions that we want to get the word out. And once we're ready to move into that tier, then we'll be ready to go and offer them vaccines.
Thank you, Dr. Huhn. So a question that's coming up is, can I register for the vaccine? People, we're not registering for the vaccine. Can we please clarify that when they're putting their information in the survey, exactly what they're registering for? Because I'm getting folks asking about actual appointments or when can I make my appointment. So can someone jump in and help us understand what the registration link is all about?
Yeah, so let me just clarify that. So it's not a link for registering for the vaccine. It's a link to complete a survey. And essentially what you're doing is helping us understand how many people there are out there that need to be vaccinated by completing the survey and sending that information to us. So you're helping us with our planning, but I think you're also helping yourself because again, we intend to, on a regular basis, push information out there about how and when we'll make vaccine available and about what we're doing with our vaccine response.
So I have a question that's come up about, and it's from Gyro Cruz. What is the process for outreach into the community? And I do think this is a good time to bring up our community-based organizations. And I know there's several folks on this panel who can help us help answer that.
Sure. So why don't I go ahead and get started, and then others can join in. You know, the president and the commissioners have been very clear to our health system and to the team here that they want to make sure that we have the most equitable rollout that we've ever had throughout, you know, anything else that we have done. This is a very important moment. We will be reaching out to CBOs. We will be reaching out to different organizations. Today is simply a start of our journey and how we help put COVID down through a community-based effort where we all work together to do that. So in the coming days, we're going to have opportunities where CBOs can sign up, where organizations can volunteer to work with us, where we will be able to work together to inform all the people that we care about what we need to do in the vaccine. And so we're very excited to work with you. If you give us a little bit more time, we're going to be coming back with the process where you can sign up and you can partner with us. But please reach out to us, to the commissioners, to your teams, to the president's office. We will work with you every step of the way and get you information. It is really going to require a joint effort, and people are going to have to hear from people who they trust and how they reached the decision about whether to vaccinate their loved ones and their family. So just join us. We'll have more information very shortly, but it will be very thorough. And we want to work with each and every one of you and every community, because the process for healing starts with communication.
I would add to that, Commissioner Deere. I would add to that. I certainly agree that we will be engaging as many community-based organizations as possible. There are quite a few that are ready to rock and roll even now. I take it a step further and say that many of the pastors that I've spoken with are ready to spread the word too and spread the message in their respective churches. And I know that the Department of Public Health has also been talking about trusted voices, individuals who will help to get the word out. And so we will be trying every single avenue. This will not be a bushel hidden under a light. We're going to make sure we shine this light everywhere that we can, so that you have the information that you need, and you can feel as comfortable as you can in getting this vaccination.
So I want to address something, because I live in Evanston and I've seen several folks in there ask about Evanston and Skokie. Evanston, Skokie, Stickney, and Oak Park have their own health departments that are federally funded. And so when we're talking about suburban Cook County, I can help everybody with that question. So I've seen it a couple different times. If you're in Skokie, if you're in Evanston, if you're in Oak Park or Stickney Township, you have your own health department, and we can get you a link to those. That's my cue to the folks getting the links in the comments. Sandy asks, if you're a snowbird, do you have to return to Illinois for your vaccine? Sandy, that's a great question. Can someone please help Sandy?
I don't think so. You know, I mean, there's going to be several options where people can get their vaccine. And so if Sandy is down in the South and they have their rollout and she has established, I guess, you know, some sort of identification down there, then she should be able to get her vaccination down there. And I will say that it's important that second dose, whether it's Pfizer with 3 weeks or Moderna with 4 weeks, Sandy wants to assure that she's going to be able to get that second dose. Hopefully, if she's still down there, if she comes back up here, we can try to make accommodations.
Yeah, we're not going to be mad at you, Sandy. Ina Cantor wants to know, and how about Glenview? I've said that Glenview is included, and there's parts of Glenview that might be in other counties. So I do think that is one of you have to look at where you are in Glenview. But no, Sue Goldberg, Glenview does not have its own health department. So you are going to be attached to a county in Glenview. Let's see. Oh, when will suburban Cook County schools and school districts? That's a great question, and that dovetails into there's been several folks, including Chantel Pentherbridge, who's asked, are children under 16 going to be able to get the vaccination? Can I have one of the doctors address the under 16 question, which will help with the school age?
So I believe that eventually then school-age children will be able to get the vaccine. They have not been studied in those large trials that Dr. Joshi showed. That was for 16 and above for Pfizer, 18 and above for Moderna. But what we will do is we will have some information on how the immune response happens in school-age children with very small trials. And once we have that information, and we believe that it's probably going to be a good response, probably even a better response. Those adolescents actually respond better to vaccines. It's a perfect time to be vaccinated when you're in your adolescence. Once we have that information, I think that the FDA then will then approve those vaccines for the lower age groups. But that's going to take several months.
Excellent. So anyone else want to jump in on that?
Just wanted to make a quick comment about schools and the education sector and when that would be. So that's in phase 1B. Unless you happen to be a school nurse or an occupational therapist or a physical therapist that works in the education sector, you're a healthcare worker, and you should sign up on our website if you're in suburban Cook County, and we will provide information to you as to how and when you can get vaccinated.
Excellent. I want to highlight Nancy Vick's question. She wants to know, how will we be sure we're getting the second dose from the right vaccine? Do we need the Moderna? Can Dr. Fegan, can we grab you in here, or is that not one of yours? I want to make sure you get to talk too.
Yeah, well, so I'm Claudia Fegan. I'm the Chief Medical Officer for Cook County Health. And, I'm proud to say that I've practiced on the south side of Chicago for more than 35 years. So I know a little bit about the community we serve. And so everyone who gets the vaccine gets a card that has the vaccine you received. It identifies the lot of the vaccine that you received. And so then it'll be easy to determine, to make sure that when you're getting your second dose, that you're getting the one that if you receive Pfizer, you'll get Pfizer. And if you receive Moderna, we'll get you Moderna. But I wanted to make sure that we address, there are a lot of people who sound very interested in getting the vaccine. I'm concerned about the folks who are afraid to get the vaccine or want to hold back. Let me wait and see if this is safe. And so because I've worked in the community for so long, I take pride in the fact that, I went to medical school to take care of the community I live in. And so I have been proud to work at county for more than 20 years and take care of patients. And I think it's important that we meet patients where they are. And so we have a lot of reasons not to trust the medical establishment. We often are taken care of by people who don't look like us. And therefore, we have reasons, and there's things that have been done to us that are a lot of reasons for us not to have trust. And it's why I love what I do. It's why I love taking care of patients. And I want my patients to know that this vaccine is absolutely safe. They're afraid that it came out too fast. This is a technology that we've been using for years, and we know that it works. It's very effective. And I want patients to know I have my vaccine. I'm looking forward to getting my second dose of vaccine. And I want my patients to be right there in the front of the line to receive the vaccine, because it's been for too long that we were at the end of the line, and we're trying very hard with Cook County Health to make sure the people who need it the most will get it first. And so I'm proud of the work we're doing, and I'm really looking forward to making sure as many of our patients get vaccinated as possible. And we're going to take care of patients. We expect to take care of patients in the city as well as outside the city. I know our Department of Public Health and the Chicago Department of Public Health are working together to make sure that we can spread that. And while Dr. Joshi's job is to make sure that we do it in the suburbs, we also expect to be able to offer the vaccine at some point in the future in our clinics that will be in the city. So it's important work, and I want my patients to know it's safe. I recommend it, and we all believe in it. Thank you.
On that note, we have a question from Bali Singh that says, are we expecting other companies besides Moderna and Pfizer to be certified to be administered in the U.S. soon? I think we saw another AstraZeneca somewhere else, but can any one of you address that?
Yes, and we will. So in the United States, there were 4 trials, these large trials, what we call phase 3, gold standard trials, to where we're able to safely determine whether these vaccines are effective and they're safe. These happened in parallel. They started enrolling in the summertime. The 2 for Pfizer and Moderna were the first ones up. We have AstraZeneca coming up probably at the end of January, where we're going to have the data that goes to the FDA to look for approval. And then one from Johnson & Johnson, which is a 1-dose vaccine and that's probably going to go in February. So we will see more options. These vaccines, they're not mRNA vaccines. They're a little bit different. They also use technology that we've been accustomed to for several years, and a little bit more flexibility in the storage. They could be stored in refrigerators for months and months. So a greater ability then to reach more and more people that may not have the opportunity just to go to certain specialized centers with those ultra cold freezers.
Dr. Huhn, can you, and the doctors also, I think there's one of the things that has come up in just questions, and I want to make sure on this topic, that some people wait and say, well, I'm going to wait for this other vaccine, and I'm going to wait for this other vaccine. Can you talk about if there really is anything better, or is the risk of waiting worth it? Because I think that's an important question that we hear time and time again, and it's a good opportunity to talk about that.
Mr. Rocha, I've had the honor and privilege of spending some time with you these past couple of days and talking to our healthcare workers, and I think you eloquently will state that we don't want to really risk any second where we would want to wait when we have the opportunity now, and once it's available to those that come eligible in their certain tier, to then really grab hold of that vaccine. I don't think that there's much to gain by waiting. I think, as Dr. Fegan said, that we know how safe this vaccine is. We know how effective this vaccine is. And the effectiveness, as Dr. Joshi said, really kicks in about 10 days after your second dose. And 95% is spectacular. It's breathtaking. It's where we need to be to get us to the other end, the end game for COVID as we defeat this virus.
Excellent. There's another question, several questions about comorbidities, and there's been questions from folks throughout about, hey, I have type 1 diabetes versus type 2. And in Dr. Joshi's presentation, you said something about critical populations. It seems like that this might be a good time to address, where in the phases that folks with different types of pre-existing conditions, where do they land? Regardless of their age, I think is what I'm seeing.
Yeah, I wouldn't be surprised if we see this change, because one of the things that, we've learned about COVID-19 is that the research around it has been moving nearly as fast as the virus. Obviously, we'd like for it to move faster. And so we're learning and learning more and more every day. So just with respect to the question about diabetes, CDC has done a lot of review of all the research that's been published. In their opinion, it seems that diabetes type 2 clearly raises your risk of worse health outcomes from COVID-19. Diabetes type 1 is also on the list. It's not as much risk as diabetes type 2. So there's a little bit of differentiation there, but I expect that, again, as we learn more and more, this may change.
And I will add for diabetes type 2, there's an obesity epidemic as well, and that can go hand in hand with diabetes type 2. And so persons with obesity, over 100 million here actually in the United States, that is a high-risk medical condition that we are targeting for those, certainly as we move into the tier 1C group. And it also, thank you, yeah. I saw Denise was about ready to jump in.
No, don't ever worry about me. I'm just trying to also get all these comments. We got a great comment and question from Sherry Leo. She lives in Chicago, but is an essential worker in Evanston. All right, and she hasn't worked since March. How does she get vaccinated to return to work, and where does she do that? She works in Evanston, lives in Chicago. Help us out, y'all.
So I don't think I could speak for either Evanston or the city of Chicago, because as you mentioned, neither are my jurisdiction. But I will say this, for suburban Cook County, for our health department, one of our guiding principles is that we don't want anyone turned away, okay? So we will vaccinate anyone who lives or works in suburban Cook County. And look, if somebody from Evanston happens to turn up at one of our vaccine sites, we will vaccinate them.
Got it. So someone is asking about sheriff's police, and this brings up a question that has come up and earlier about folks in our Department of Corrections. Can someone address how they are fitting into our tiers of phases?
So right now, for first responders, police, firefighters, they're actually in tier 1B. But if there are some that may be, again, have duties within the healthcare field, there may be an opportunity as we move through phase 1A, phase 1B, that they would be captured early on.
So Peggy asks a great question. She said, when 1B opens up, demand will probably exceed supply. How will it be determined who gets those vaccines?
So those discussions are ongoing. We've been talking about this quite a bit at the health department, and we've also been talking to the Chicago Department of Public Health, because the last thing we want is, for folks in Chicago to be subject to one group of guidelines and folks in suburban Cook County to be subject to another. We also know that the state is working on making some revisions to its plans and how, those groups may be further prioritized. Regarding the surge of folks that we anticipate, particularly with the state dropping the age from 75 to 65, which I want to be clear is a good thing. We have learned recently, like just as of today, that both the state and federal governments are looking at making a lot more resources available to assist in this process. This is breaking news that I literally just heard about 6 hours ago. So certainly more to follow on that.
And I want to take this moment to remind everyone that, not to use a bad sports analogy, but this is a marathon, and this is our first out of the gate mile with you. We intend to do these types of forums, not only as a virtual town hall, but also in community-based organizations throughout the county. And so I want you to know that this isn't your only shot that you're going to get to talk to these people. This isn't the only time you're going to get to lob these questions. Know that this is going to be ongoing. And we're telling you everything we know today. I love that Dr. Joshi just said that was 6 hours ago. That's how quick things are changing. And I want to highlight that there's a hotline that's scrolling across the bottom, because many people have said, what if you're not on Facebook? What if you don't have access to the internet? Right there, you see that Call Cook County Department of Health. There is a hotline that people can call and get some of the same information that we're giving tonight. They can get on that hotline as well. And again, we are distributing information through community-based organizations, many of them. And so know that some of this information will likely be in a flyer or in a paper that you can actually touch and not just be a digital thing. Marcella says, my husband has violent reactions to amoxicillin. Should we be concerned? And just so you know, that's Marcella's question is representative of many like that I've seen in the chat, folks who have allergies or folks who have bad reactions to other vaccines. Would anyone please answer that question about someone who might be concerned because they have allergic reactions to various types of medicine?
Sure, yeah. Marcella's husband is certainly eligible for vaccination. The people that should not get vaccinated are really a very, very small segment. Those that have a severe allergic reaction to any component in the vaccine, and some of that might be that polysorbate, also called polyethylene glycol or PEG, which can be found in some common household products like toothpaste and shampoo, but very rarely would somebody have a violent allergic reaction to that. But if somebody actually has a history of allergic reactions to other types of products or medications, they can get vaccination. We've done that here at Cook County Health, certainly, and they would just be monitored for about 30 minutes then.
Excellent. We have someone asking, that will the information be translated to various languages? And yes, someone is saying that in the chat, but I just want to reinforce that out loud, as well as there is a plan to have, for sure, town halls in Spanish. Let's see. Ooh, someone is asking, it's Anita Krieger. She says, when the vaccination becomes available, will appointments be necessary or will it be a first come, first serve? And she said, e.g. long lines. And I'm thinking she's saying that based on her experience with testing or something like that. Can someone jump in and help us answer Anita's question?
So I'll start a little bit, and definitely the team can join in. I would say that we are still in the process of rolling out scheduled appointments. Is what will probably be done in the first few waves as we start to get patients to come in. As it starts to go into larger numbers, I think that's something that we're going to work together to see how quickly and how rapidly we can get the vaccines in arms of all the people that we want to be able to serve. So I would say the first few openings will probably be something that you will need to schedule with your provider, and there's going to be a lot of resources that will help you walk you through that process when you're available. And so that's why the information we have today is you knowing what band you're in, when you're eligible, and when you need to start activating to schedule your appointments. And we will help you through that process and be having some more tools that we'll be launching to help you navigate. But like all things, it's going to probably change and improve the more patients and people that we have to be able to help.
I'm sure that question came in response to the decision that some states have made, like Florida made a decision to do first come, first serve. And that always creates a problem in terms of long lines. We really want to try to have a more reasonable approach so that we can get people in a timely fashion, and that it's not someone having to get up in the middle of the night to get in line for a vaccine.
All right, thank you. Newland Smith asks, what are our plans for homeless? That's a great question, Newland. What are our plans for the homeless population in suburban Cook County? How are we handling that?
Yeah, that's a good question. So homeless, so congregate living, homeless shelters, et cetera, are in phase 1B. And we've started to have conversations about how we could ensure that that particularly vulnerable population, that we are reaching them and that they're vaccinated.
I think Donald Duke's question dovetails on that a little bit, because he's saying about people with mental illness that are in SUVs. Is that the same served by CBOs and group homes?
I saw the group home question. So I think group homes happen to fall in phase 1A, according to recent guidance from the Illinois Department of Public Health. So we have also had conversations about, identifying all the group homes in suburban Cook County, and leveraging, for example, our partnership with Jewel Osco to go to each of these group homes and ensure that all of them are vaccinated. All of their residents and staff are vaccinated.
Excellent. Let's see, someone asked, is Cook County IT up for the surge and the registration? Thanks, Jim Sullivan. Can someone address Jim's thought about IT and a surge?
All I can say is that we are all working together to make sure that we have every resource possible. Through this process, like most things, I'll be the person to say we're going to have all our set of challenges, but we're going to work to make them as seamless as possible and bridge those gaps. And everybody's going to be working together. And even though you hear jurisdictions about city and county and this place and that place, in this moment, we're all one. And that is what we mean to be equitable. We will help you find the place that you need to go and have the resources that you need to be able to save you and your loved ones. So this is a start. We're going to get you numbers, we're going to get you information, and we're going to do our best to make sure that our IT is there. But like all things, IT can be temperamental, but we're going to do our best for that never happens.
All right. Susanna Alvarado asks, once you get the shot, 10 days after the second shot, are you immune to COVID? That's a great question, because we heard on a call earlier. We heard on a call earlier that people that are getting the vaccine immediately believe, oh, I'm free. I can move about the country as I need. Can someone address that question from Susanna?
So you don't have to be a statistician to look at the charts where 10 days after the second dose of the vaccine, those that got the vaccine are flatlined as they go out month after month. And those that did not get the vaccine in those trials, their curve is going up and up and up. So that's true. 95% of those will be immune. We don't know how long. The second dose gives you a boosted immune response, so hopefully it carries you throughout the year. And we'll find out as we move toward the summertime and the fall, who's actually going to stay protected. But that is true in mRNA vaccines, Pfizer and Moderna. We've seen 95% protection.
But I want to make one point here, and it's a very important point, that you get the vaccine not just for you, to protect you, but for your family or for the other members of your household. And so therefore, even after you've been immunized, it is important to continue to wear your mask and take those precautions, because we don't know about your risk of spreading spreading COVID with exposure. So it's important that we continue to wear our mask, continue to socially distance, to maintain those things. It's important that you get vaccinated, not for just you, but for your family and for your community, because you want to protect others. But it's also important that once you have been immunized, that you continue to try to protect everyone, and that we all need to take the precautions, which means wear our mask, wash our hands, and keep our distance. And we're going to be doing that for a while yet. And even with the vaccine, you can expect, you better have that mask around at least through the summer. So let's remember, we do this not just for ourselves, but for everyone around us.
Thank you, Dr. Fegan. And thank you, Brian O'Neill, for the shout out. This is very nerve-wracking, and I'm doing my best. I want to call out the next question. Lots of people are asking, is it free? We've had lots of different ways that question has been asked. Are there out of pocket? Do you have to present your insurance? Can someone address our policy on how we're going to make sure people are vaccinated?
So I can address the from Cook County Health, and then Dr. Joshi can talk about the partnerships that he has with the different partnerships with Cook County Public Department of Health. What I would say is that for our perspective, the vaccine itself is free of charge to anybody who needs it, and there is no financial barrier that is out there. You will hear that if you have private insurance, there's an administrative fee that may be assessed to your insurance plan. That's if you have it, but there is no barrier. Everything that we work is to make sure that anyone who needs it can get it. There should be no out-of-pocket expenses, and we're going to work to make sure that there is no excuse why you don't come and get the vaccine. We do need to also just get some information from you to make sure that that we have everything that we need to put into our registries and our database and how we operate. But outside of some information and a little bit less than a minute of your time that it takes to actually get the immunization, that's pretty much what we're going to be asking from the individual. So if you have questions, again, we'll be available, but that is the cost. No barriers, and we will get some information from you.
That's absolutely right. The only people seeing a bill here are going to be the insurance companies. Nobody should see a bill. That should not be a barrier.
Excellent. We did have a question that I seem to have missed, directed at the president about her op-ed. She's like, yes. Regarding your getting the vaccine, when you're getting the vaccine. I think someone saw in your op-ed that you're getting it when it's your turn, but people are wondering about you and the vaccine. So can you address that for it?
Sure. Well, I just learned from Dr. Joshi that I've been moved up from 1C to 1B. So as soon as we get to 1B, I'll get my shot. I didn't want to jump the line. 1A is healthcare workers. I'm not one. My daughter is, though, so I'm glad that she's going to be able to get the vaccine. And folks who live in nursing homes. So since 1B is 65 and older now, rather than 75 and older, I'll be in the 1B category, and as soon as it's available, I'll take it.
Excellent. So you got a promotion because you moved up.
move closer to the head of the line. Yeah.
Closer to the end of the line. Thank you, President Preckwinkle. Let's see. So there's been let's see. Someone says, Luann says, is it true that after I get the vaccine, I can still get or spread COVID, but maybe not be as sick? That's a great question, Luann.
So it's possible, but remote, I would say. So the way that we determined how effective these vaccines were was to protect against symptomatic disease. And so that 95% means that 95% of those that got the vaccine were protected against symptomatic disease. And most importantly, virtually all those cases that broke through, let's say just the dozen of cases that broke through were mild. I think there was only one severe case in somebody who got a vaccine for one of those mRNA vaccines. So pretty much there's protection there against symptomatic disease. And we believe that there's probably protection, as Dr. Joshi showed, against asymptomatic disease. Not as much data for that, but for the limited study that we've done, where those persons that got that vaccine, they got that swab. If anybody's experienced that, that's quite a sensation. But that those persons that got swabbed, about 2/3 of them in the vaccine group did not have asymptomatic disease compared to those in the placebo group.
Thank you for that. So Betsy Pilmer asks a great question. What proof will be required if you have pre-existing conditions? Like, what do you need to show that you have it? Thanks, Betsy, for that question. Do we know yet?
Yeah, no, I think that's something that we're working through. Again, it goes to my comment that we don't want anyone to be turned away, but we also want to deliver the vaccine in a way that's responsible and orderly, and have some assurances in place that people aren't jumping the queue. But again, that said, the guiding principle here is that nobody should be turned away that should get vaccinated.
All right, so I am not ignoring you, all those people who are asking if you have to have a vaccine to travel. We are not the U.S. State Department, nor are we the Departments of State for other nations. We cannot answer that question. It's been asked repeatedly. That's not one that we can, because it's asking, well, will other countries require proof? We would not be able to answer that, Lisa, sorry. Let's see. Okay, I think I'm hitting almost all those questions that we have had. Let me just double check. I think we already asked, once vaccinated, are you still a carrier, right? Yes? Mm-hmm. Awesome. Okay. Oh my goodness, I am not even believing this. Let me just check, a couple more just came in. All right, how will people be notified that it's their turn for the vaccine? So again, if you've registered, we are going to be pushing out information, but can someone just reiterate that again?
So I anticipate as we move through the phases, we'll start putting out more information and similar kind of like maybe a survey or something like that for the different populations that are going to need to be vaccinated. We'll notify the public in general that there's been a change in the phase. People will know who's eligible for that. They'll fill out the survey on our website, and then we will push information to them about how and when they can get vaccinated.
Awesome. I think we've touched on the kids, right? Is there a future plan for kids? Yes. All right, Alex Rothschild, we're ignoring you. The finance sector, no, we don't know when. I'm just kidding, but you have to watch, right? We've told you what we do know, and so I'm not ignoring you, but we absolutely will keep putting up information about when. But I'm guessing unless you're a pre-existing or an elderly person, it's going to be a while. So chill out. You got some time.
So finance is tier 1C. Okay, so they're considered an essential worker. So
okay, got it.
Yeah, tier 1C.
What? Because I guess that's the other thing. Does that mean, here we go, tier 1C? Got it. Thank you.
Yeah, let me just give a rundown of the tier 1C. Okay.
Thank you.
So it's transportation and logistics, food service, shelter and housing, construction, finance, IT and communication, energy, media, legal, and public safety engineers, water and wastewater personnel.
Got it. Thank you. Somebody saying that we didn't give an answer on allergies. I thought we did, but can we have someone else reiterate? And that's okay, because you may have joined us after we said it. So for people who have allergies, who might be worried about getting the vaccination, how do we?
I think the simple answer to this question is it's a conversation with your provider.
Thank you. Thank you. All right. Okay, so Lorna says, why do you keep saying if you're registered? Because we are asking you to register yourself for information. That's correct. We're not saying register yourself for a vaccination. We're saying if you want to have information continuously pushed out to you as we move through these phases, we are going to need some information from you. And that actually brings up a question that I don't think we addressed verbally, but someone wanted to know about the safety of their data coming to us. And because we're asking some sensitive questions, they want to know how we're protecting their data. Can someone? Yes, thank you.
Yeah, the tool that we're using to collect that information is, it will protect your health information. It's the same tool that we use, for example, to collect information during outbreaks. So it's that same level of security.
Excellent, excellent. All right. I think we have hit it all. Katie Gallo just got in with the last minute. I may have missed it. Where do teachers fall?
Yeah, frontline essential workers, Tier 1B.
Tier 1B.
Yeah.
And we've put a link out there for the presentation, which has are all those tiers in our presentation? Yes, and there was a PDF link. Can we also put the link for the city of Chicago, because that is also being asked. All right. Wow. We have 10 minutes to spare. So I think it sounds like we've gotten through everyone. And like I said, we will be back. This is the first of many of these forums where we will answer your questions. And any final thoughts, maybe President Preckwinkle, to send us?
Well, first of all, I'd like to thank all of you who have joined us this evening and given us an opportunity to share the information that we have with you. And we hope that you'll share that information with family and friends and neighbors, particularly the update on those eligible for 1B, my cohort, 65 and older. So basically, if you're eligible for Social Security, you're eligible to be in phase 1B, okay? Anybody who's eligible for Social Security is eligible for 1B. So that's an important change in guidance. I think the previous guideline was 75 and older, so we've gotten 10 years. I want to thank Commissioner Deere, whose staff worked hard on this and whose idea it was to bring everybody together to have this town hall. I want to thank Denise Barreto for being our moderator, Israel Rocha, the head of our Cook County Health and Hospital System, Dr. Kiran Joshi, who's co-leader of the department, the Cook County Department of Public Health, and of course, Dr. Fegan, my neighbor and friend, who's medical director at the Health and Hospital System, and Dr. Huhn. Did I say it right?
Dr. Huhn.
Yeah, Huhn. That's it. Yeah, had to get my.
You're not a Huhn, you're Huhn. Okay, good. Dr. Huhn, thank you very much for joining us. We appreciate everybody's help and support. And as Denise Barreto said, we'll be doing more of these as we try to work our way through the pandemic. So please stay in touch with us, and we will try to get information out to you. I think scrolling across the bottom of the screen is how you can get a hold of us on the internet. And there was a previous scroll that gave you the number of the Cook County Department of Public Health, so you could call and get information as well. So thank you all for joining us this evening. We're very grateful. There's the phone number scrolling across the bottom, 708-364755. So thank you.
And you can also watch this on a replay. If you came late as we're closing, know that this will be out on YouTube tomorrow and on our Facebook channel. Thank you all, and have a great evening.